we are in the ultimate relationship business because we know a lot more about the individual than any other business does. That requires a lot of trust, and we have to have this functioning relationship with that individual to build that trust and to make sure that we earn that trust moving forward also.
Hi, I'm Chris Malone, and I'm glad you're able to join us today. Before we begin, I'd like to welcome our friend, colleague, and program partner, Michael Giuliano. Michael is president of Planetree, which is the global not-for-profit organization dedicated to humanizing healthcare for everyone through excellence in person-centered care. Hi, Michael. What can you tell us about our guest today?
Thank you, Chris, and welcome everyone to the July episode of Humanizing Healthcare. Great to have you with us. We're really pleased to have Sven from Northwell Health join us today as our special guest. Sven is the Senior Vice President and Chief Experience Officer at Northwell Health, New York's largest healthcare provider, serving New York City, Long Island, and Westchester across 21 top-rated hospitals and over 890 outpatient facilities. Northern Westchester Hospital, part of Northwell Health, is gold certified with distinction in Planetree's global certification program, recognizing excellence in person-centered care. Northern Westchester has also been certified since 2007 and one of the original hospitals to pilot Planetree's world-leading certification program. Sven is responsible for building an engaging, innovative, and collaborative culture that drives organizational growth and customer loyalty through the customer experience. He came to Northwell from the Henry Ford system in Detroit, where he served as Vice President, Hospitality and Service Culture, responsibility for creating a superior and consistent service experience for patients, visitors, and employees. Sven began his career in the luxury hotel business, which we will hear more about, holding a series of leadership positions with the Ritz-Carlton Hotel Company, responsible for executing and implementing Ritz-Carlton service standards, training staff, and leading teams of trainers. After contracting a rare disease, Sven experienced firsthand the impact and importance of quality patient care. Despite his background in hospitality, the diagnosis and the subsequent recovery process sent Sven on a path to a career in healthcare. In this episode, Sven will share how he takes what he's learned from the hotel industry, as well as being a patient himself, to bring humanity to healthcare. As you listen, you'll gain a deep understanding of the patient and employee experience and learn about the benefits of creating environments where human connections can thrive. I'm really looking forward to the discussion, and thank you again, Chris, and thank you again, Sven, and welcome to the episode.
Thanks very much, Michael, and welcome, Sven.
Thank you both. It's a pleasure and honor to be here.
Well, as Michael referenced, it sounds like you've had a kind of a unique journey to your current role at Northwell. Can you tell us about how you found your way into healthcare? Michael kind of whetted our appetite, it seems.
Yeah, that's definitely the main reason why I do what I do today. It started when I was living in Detroit, and the Henry Ford Health System was opening a brand new hospital, and they wanted somebody from the hotel industry to infuse hospitality into the organization and into the opening of the new hospital. And they asked me if I knew anybody. And so then I, after a few phone calls and several discussions, I realized that I can really marry my professional experience and skills that I've learned in the luxury hotel industry with my personal experience as a patient, and to put that to good use. And I haven't looked back ever since. But being a patient has taught me a lot. And I was hospitalized for 3 months, and that was not the end of it. And I was paralyzed from head to toe with Guillain-Barré syndrome. And so when you lay in a patient bed and you can't do anything for yourself, you can't move your face, your arms, your legs, nothing. And you're very vulnerable in that state. You depend 100% on everybody around you. And most importantly, you have to trust everybody around you. And you're there for a long period of time. You live there. The people become your community that work there. So you get a very good understanding of how healthcare works and what doesn't work, and what patients go through. And I actually, after the hospitalization, I came home and I was still in a wheelchair, and then my home health journey started until I was well enough to go to an outpatient facility. and then it was almost a year until I was back to full strength and fully recovered. And what I didn't know at the time, that the term continuum of care existed, but I went through the continuum of care from presenting at an urgent care center all the way to home care, ambulatory care, and then to get back to the life that stopped very abruptly. And I always say to, especially our new employees, when I talk every Monday to our new employees, that it was a very painful year. It was probably the most challenging year of my life, but in the end, it was the most rewarding and probably the best year of my life because of what I learned through that experience.
Wow. And wasn't it an experience that was really great that made you want to be a part of healthcare? Or was it the fact that you saw opportunities for the experience to be better? What was it about the experience that draw you in to want to work in healthcare?
Well, it was both.
Okay.
Absolutely the when you're outside of healthcare and then you're in it, the admiration, appreciation that I gained for the people that cared for me was just tremendous, and there were so many that were just absolutely incredible, and so much empathy, and I felt so connected and well taken care of. But I also saw a lot of areas of improvement, and that's especially with my professional expertise, and I compared and contrasted to what I've been taught in the hotel industry, and there were some employees that took care of me that were the opposite of empathic and kind and caring, and then you lay there and wonder, like, what is happening? What's the consistency of the hiring process, the training, where is the leader? Do they know that this employee is treating, or shall I say, mistreating patients? And so that's a lot of that went through my head, and I was that's kind of the fuel and the energy to wanting to change the status quo and to see what we can bring from the hospitality industry, while we respect and admire, as I said, the incredible expertise of healthcare, but marry the two and hopefully make it better.
That's a really remarkable experience, particularly being as dependent on others as an adult for such an extended period of time. I guess you did get to see the variability of that experience that many other patients wouldn't have had perhaps the exposure to. So are there any particular practices or principles from hospitality that you have found, particularly helpful or applicable in healthcare?
Yeah, I think one I mentioned already, it's that the consistency of the human interactions. The concept in hospitality of onstage and offstage is very different in the healthcare industry, especially in the hospital. There's not a lot of offstage areas, so you're constantly in front of the customer, in front of the patient. And in hotels, for example, we would train our front desk staff that when somebody walks up to the front desk, you stop what you're doing. You may be in a personal conversation, you stop, you put your full attention to the individual that's approaching. You make eye contact, you greet them, you make them feel good and warm and welcome. And while you also have to register them and give them keys and do all these things. In healthcare, not just in the hospital, but in the ambulatory environment, you feel like you walk up to somebody and they finish what they're doing right now before. Then when they're done with this, then they give the attention to you. That doesn't happen in the hospitality industry, typically, at least in good facilities.
Mm-hmm.
And as a patient transporter, as a patient that was being transported through the hospital, I've had patient transporters over my head having personal conversations, and there's nothing you can do, and you're not, you're feeling terrible. You don't want to hear what happened at the bar the night before, or so that's definitely one of the learnings. The focus on preferences also. If you think about how we in healthcare know so much about the individual from a medical perspective, but we sort of ignore what we know about them as a human, as their what their likes and dislikes are, who they are outside of healthcare. We do that in an episode, so the nurse that is on a unit knows everything about you and gets to know your kids and all those things. But then we don't keep track of that. In the hotel industry, that was one of the key areas for us to do, is to build that relationship, was to get to know the person and then to customize the experience based on their preferences. And no matter where you were, may have been in one hotel, you check out there, 2 months later, you go somewhere else and you requested something in the old hotel, you don't have to say that again. It goes with you. And so that's I think a key learning, as well as focus on first impressions and creating the environment that is conducive to healing. So at Ritz-Carlton, one of the principles that is in the Ritz-Carlton Credo is to enliven the senses to instill well-being. And how do you do that? Is it visually appealing, the space? Does it feel good? What does it smell like? I'm a big proponent of sound in healthcare facilities, of soft music playing in the background that's more like spa-like, and not a TV that has the horrible news that with whatever happened blaring, and nobody wants to see that when they're registering or checking in for a doctor's appointment. So to have this holistic experience that instills well-being and makes you feel good.
Well, you said a number of things there I think are very notable. One was your point about the degree to which you get to know, the patient and what they are as a person and outside in their life, and to the importance of tailoring and customizing that experience. Those are the evidence that there is a relationship, right? That we know who you are, we remember about you, we personalize that experience. Whereas if we ask the same questions over and over again or treat every patient identically, those are the hallmarks of a transaction, not a relationship. And so I think that's really notable. And very clearly in hospitality, they want to build lasting relationships. But I think those same expectations we carry with us even when we seek healthcare. We don't necessarily want to be there over and over again, but when we're there, I think it does matter to us.
Absolutely.
So Northwell is really widely recognized for its very engaging and collaborative patient experience culture. And I wonder if you could tell us about, how that comes about and why that is so important at Northwell.
Well, I think it starts at the top, right? It starts with understanding and making it a priority that the patient is a customer. I think there's a lot of confusion now in terms of what should we call patients. There's a lot, the word consumer is used a lot, customer, patient. I believe that all three can be used, and I'm not a big fan of the word consumer, especially when we talk about it in the context of having the patient inside of our facilities or in our care. They're consumers of healthcare services, obviously, the people that we're looking to attract, that we're looking to bring to our facilities. But once they're in our care and once they are committed to us, they're a customer to us as an organization. But when they are in the patient bed, when they are in the exam room, when they are in front of one of our physicians and nurses, then they are patient. And we should never break that. There's a sacred relationship, and you turn people off in healthcare if you don't position it that way. And we're very mindful of that. So that's where it starts, to recognize that the people that come to you for services have choices, and they can go to other places. We're lucky that we have an incredible CEO in Michael Dowling, who firmly believes that, and the culture starts with him. He takes 2 hours out of his schedule every Monday and every other Friday to spend with our new employees. So we're a large organization. We have 87,000 employees. We hire about 1,000 people a month. So we have 200 in orientation. We bring them all in person, and then he speaks to them in person for 2 hours, set the tone. And one of the things he talks about is that we're in the customer service business. And he talks about those concepts that I just shared. Then it continues from that to then we do on-site orientation. But after actually Michael Dowling speaks, I come on and speak about our culture of care, which is how we define our patient experience culture, so that on day one, they understand that the patient experience is a priority, that our values, our organizational values, are very important, that we don't just put them in a frame and put them on the wall, that we are living and breathing them, and that we as leaders are hopefully leading by example. And we always get incredible feedback from our employees that we do that. We had to take a break during COVID. We had to do this remotely, which was painful. But as soon as we were able to get everybody back, we brought everybody back, and you feel the difference. And I can't tell you how often I get employees when I go out and about at our facilities who remember that day, because the first day is what Horst Schulze, the founder and previous CEO of the Ritz-Carlton Hotel Company, positioned as a significant emotional event, like your first day at work, because you start a new chapter, and you have the ability to change behavior and to set somebody up for success right from the beginning. And then it is obviously very closely connected to all of our efforts around building an employee-centric culture also, so taking care of our employees. And we've been on a journey to improve our employee engagement side by side with improving patient experience, having a culture of inclusivity. So all of our DE&I initiatives are very important. We also talk about that on day one with our new employees. So those are some of the cornerstones, I would say, of the culture we're building at Northwell. But it all goes back to leadership and the expectations of leaders. You can't be successful at Northwell if you are not focused on the relationships with each other, as well as the relationships with our patients and with our employees.
It sounds like Northwell has really invested quite a bit in that orientation and onboarding, that kind of first impression, that emotional event, as you described, is a key pillar of your kind of culture of care. Are there some other pillars of your culture of care that might be a little different than other places, or that are particularly notable that you or your CEO talk about in that orientation?
Yeah, it's that's really just the introduction on day one, and then it's followed by a whole training program around the culture of care, and it goes all the way to we have a policy that's approved by a policy committee around the culture of care, as well as competencies that are role specific. There are very specific items like how do we interact with people. It's like a communication model. We call it Connect. Each letter stands for something. It's similar to what the Studer Group created many years ago, the AIDED model. We made it our own, and actually had a contest around that. So we engaged like over 1,000 people in creating that. We have a service recovery component to that. We talk or instill in every employee from day one that everybody's a patient advocate, that it's not just a patient advocate team that deals with complaints and concerns, that when they hear about a complaint, a patient having a negative experience, that it's their duty and responsibility to step in, to listen to them, to apologize, to help them solve the issue, and so that the patients feel that no matter who they talk to, they somebody will help them with their issue, and that creates loyalty. That when how you react to that, when somebody has a problem, a complaint, or an issue, then that creates more loyalty and more trust ultimately, as you know.
Well, it sounds like, that orientation is just the kickoff, and that you've got a lot of structure, a lot of ongoing support, and that this kind of culture of care and the way that we interact with patients is really built into the way that you operate, which I guess it's not just a layer on top of care delivery. It's embedded in the care delivery, it sounds like.
Absolutely. It's not the frosting on the cake, it's part of the cake.
Mm-hmm. And are there any particular initiatives or projects or programs that, as a result, come out of this that you may have implemented in the last few years, and anything that you could share with us on those?
Yeah, absolutely. I think an important initiative and program is for physicians, which are often many leaders would describe it as more challenging to get them engaged in patient experience. I think we're pretty lucky that we have an incredibly engaged physician group here. We have 5,000 employed physicians, and then many credentialed physicians as well. But we have a whole program around relationship-centered communication that we've started here. And we have started that several years ago, and we're up to over 3,000 physicians that have gone through that. And that is a full day training around creating the relationship, creating trust with the patients, giving them skills and micro tools in terms of how to frame that interaction in the best way. And that's been very successful for us, and that shows up in our likelihood to recommend the provider scores on the ambulatory side, which we're in the mid 80s, almost 90th percentile ranking. That's in New York, the patients are a little bit more demanding, and that's actually hard to achieve here. And I'm also on our physician communications scores as well, so that's something that's worked very well for us. We recently, as we are focusing more on the ambulatory piece of Northwell, just for context, we are 57% ambulatory now and 43% inpatient. So we have more revenue comes from ambulatory than from the acute care. And as it was referenced earlier, we have almost 900 ambulatory locations. And it's a little harder to achieve culture in ambulatory because you have individual entities that are spread out over the entire geography. When you have 6,000 people in one building, you create more cohesion. And we recognize that we haven't done as good of a job there in ambulatory, and also, especially as we onboard new employees, those especially the administrative staff, the people that create the first impressions. So we just created an ambulatory academy that goes through a week-long training with our employees, including an entire day focused on the culture.
Wow.
And then, most importantly, to set the expectation for the leaders and giving them the tools, the resources, and the support to do that. And we've seen some really good results so far from that.
Terrific. What are some of the metrics you rely on to kind of track your progress in these culture programs and to ensure that you are reflecting the culture of care that you want to? Are there any particular measures that are kind of a focus for Northwell?
But certainly the ones that we have to do, it's like the HCAHPS surveys for regulatory purposes, but that definitely doesn't capture what you should be measuring. I think they're very important questions, but it doesn't encompass everything. We look at our employee engagement scores, especially certain components within that. For example, we ask all of our employees whether they are recommending Northwell to their family and friends, and use that as a metric that we track. And also a question around, does your leader lead by example in delivering a great customer and patient experience? And that's, again, everything points back to the leaders, and then we see if there are issues within certain departments or not. But we're also recognizing that there are things that we need to measure that we currently don't measure, and where we have blind spots. I'll give an example. The amount of work that patients have to do that are outside of the medical and clinical encounter is just enormous. And we identified that there's just a lot of friction there, that it's so hard for patients to navigate their health and to do everything. A lot of the burden is on them to make follow appointments, to get test results. Sometimes they have to take, or they feel they have to take half a day off just to get something done. And that we feel pretty good about the time when our patients are with us in the clinical encounter, but then as soon as they leave there, that's when it's difficult. And there is a concept around measuring effort. There's the customer effort score, as you know, and we're implementing something like that here now. But looking at it, are we making it easy for you to transact with us? And I think that that's going to be a key metric for us moving forward. We're in the middle of implementing that, and I'm very excited about it because that's really the lead measure then to loyalty. We'll certainly continue to measure net promoter score, likelihood to recommend, but it's the friction that we have to reduce for our patients.
Very interesting. Now, you were recently quoted in a Forbes article to say that healthcare is the ultimate relationship business. I was wondering if you could expand on that a little bit, as well as how that compares to other, your hospitality experiences, for instance.
Yeah, it's interesting because when I was at Ritz-Carlton, and our CEO Horst Schulze, he used to drill into us. He's very, very passionate leader with a very thick German accent, and used to say, "You think you're in the hotel business? You're not in the hotel business. You're in the relationship business. Our charge and our goal is to build relationships that will lead to loyalty." And thinking about that in the context of healthcare, I think we are in the ultimate relationship business because we know a lot more about the individual than any other business does. Intimately, we know more about people than their spouses and their families do. And that requires a lot of trust, obviously. And we have to have this functioning relationship with that individual to build that trust and to make sure that we earn that trust moving forward also. And that's what I mean by we're in the ultimate relationship business. There's no business in the world where that is more important. And I think it's interesting that Humanizing Healthcare, the title of this podcast, right? Why do we even need to talk about that? We're dealing with humans. We're caring for humans. We're healing humans. But for some reason, healthcare has just moved away from that. And I applaud you and to make that a topic, and also recognizing how important the relationships are.
Yeah, and I think that's the challenge, right? As organizations become larger in healthcare, more digital, more focused on efficiencies, cost control, and all of that, care experiences often feel more transactional and impersonal, both for patients and for caregivers. And that really is not conducive to great relationships. And the thing that I find surprising and relative to other industries is that relationships are good for business in other industries, but it turns out that in healthcare, it's more important than that. It's because when you have a good, trusting relationship with a care provider, you show up for your annual wellness visits, you stay on your medication, and your chronic illnesses are diagnosed at an early stage when they're treatable. And so it's not just good, from a relationship standpoint, but it's really critical from a medical standpoint. And that's something that I think is not as widely recognized as it could be.
Absolutely.
So let's take some questions from listeners. Do you think healthcare is primed and ready to hear stories like yours, where mental health and physical health are talked about versus that being a stigma? What are your thoughts on that?
Oh, I think that mental health, obviously, for far too long has been a stigma, and that we are in the process of moving away from that. It's a huge priority for us at Northwell, by the way, especially as it comes to young people, to teenagers and young adults. We're in the process of actually building a adolescent inpatient behavioral health facility. We have programs with the local high schools where if there's an event, the teenager doesn't have to go through the ER. We have a special intake program for them, which is phenomenal, and all kinds of things. Our CEO, Michael Dowling, is a huge believer in mental health, and there's not enough care out there. So I think that we're at a time where that becomes a lot more focus. And we actually, if you go to HBO, there's a two-part documentary series out about Northwell. It's called One South, about an inpatient adolescent mental health unit at our hospital. And I think that's a sign that it's a lot more accepted. And there were patients that were willing to go on camera and to share their story through that. It's very, very powerful.
Yeah, I think you make a good point, particularly now the skyrocketing prevalence of mental health issues with young people is kind of prying that door open for many, many families who are just having to kind of deal with issues that never existed before. And even the healthcare system is now having to adapt and how they care for and intake and treat these kinds of issues. So I think it is becoming much more mainstream. For your physician training, the one-day program, did you say you developed this or did you work with an outsider to provide that support?
Great question. We partnered with the Academy for Communication in Healthcare, the ACH. They have a wonderful program and a wonderful approach, like a train-the-trainer program. And they helped us to develop our faculty and to certify our faculty. But we've woven into that curriculum what we teach at our medical school on communication, as well as the elements of culture of care. So it's all connected. So there's no conflict with that. It's about 50-60% the ACH curriculum, and the rest is homegrown Northwell. And it's our physicians actually were the ones that crafted that. And
very interesting.
We had the original cohort of 12 physicians. That's why we believe it's successful, because it wasn't something that was put on them. They created it, and we have over 40 facilitators, and we are looking to go through another certification process to get to over 50.
Terrific. Are you looking at artificial intelligence to enhance the patient journey of managing care? And if so, in what capacity?
So artificial intelligence, obviously the big buzzword. Everybody's talking about it. I personally believe, and that's something that we're investing in and looking at, is that the ambient listening component of artificial intelligence will be the best thing for patient experience, because we are finally at a time where we can take the computer away from in between the patient and the provider and make life less miserable for our providers also, that they don't have to, after clinic hours, go home, eat dinner with their family, and then be up at midnight for charting and notes. I think there's a lot of promise in that, and the providers then can focus on the patient, and hopefully in a decade from now, we'll look back at these 25, 30 years, and we talk about it like, do you remember the time that we had to be tethered to a keyboard and how awful that was? Hopefully that will be the case.
Excellent. Would love to learn a little bit more about the consumer effort score that you mentioned and how broadly that is measured. Is that kind of a new measure that's kind of in limited use, or is it kind of broadly across all of your experiences and locations?
So we haven't rolled it out yet, but there are two components to that. I think one is broad across all interactions. What the problem I have with how we measure for patient experience today is that it is very episodical. That we ask, you have an emergency room visit and you get a survey about that. You have an inpatient visit, you get a survey about that. And it's not about the all experiences you have and that relationship you have with that organization. So we'll be surveying patients agnostic to the encounter, but asking them how, if Northwell makes it easy for them to transact with us, as well as then looking though within all of the interactions and the episodic surveys and where the higher points of frictions are. So it's definitely both. And we'll be leveraging a lot of the natural language processing for the qualitative data that we're getting through that to also identify where the frictions.
Excellent. What are you doing in your organization to help combat burnout for employees who perhaps are struggling to stay, quote, on stage?
Yeah, it's a huge topic. I think it's the struggling to be on stage, and I also think we need to add that the behavior of people has changed over the last 4 to 5 years, as our employees are dealing with a lot more conflict than they've had in the past. We have to make sure that we protect our employees and that they know that they have psychological safety and that we're then physical safety, that will support them when people are stepping out of line, and that happens unfortunately more and more. And violence in our hospitals is becoming more and more prevalent. That's one thing, but then also we have many programs across the organization to help people to deal with those struggles. I can give you one example. We have a program called Stress First Aid, where people identify their stress levels when they come in, and if they are at a high stress level, then the team actually rallies around them. And it's a wonderful program. It comes from I think it was started in the military. We have an expert in that. It's been rolled out across the organization. We've seen some good results from that.
Well, I do have just one final question for you. It's one of my favorites, Sven, and that's, do you have a favorite quote you can share? And if so, why is it your favorite?
Yeah, I have a favorite quote about customer service from an unexpected author. And we actually use that quite frequently, but it's from Mahatma Gandhi. And he once said that a customer is the most important visitor on our premises. They are not dependent on us. We are dependent on them. They're not an interruption in our work. They're not an outsider in our business. They are the purpose of it. They are not doing us a favor by serving them. They are doing us a favor by giving us an opportunity to do so. Mahatma Gandhi.
Great words. Great words. Has great relevance to everything we've been talking about today, hasn't it? Hey, Sven, thank you so much. This has been a really interesting and enlightening discussion. I can't thank you enough for sharing your journey with us, both personally and professionally. To our listeners today, thank you for joining us as well. We hope you found this discussion as informative and enlightening as I have. And if you enjoyed today's discussion, please be sure to subscribe so you don't miss any future episodes. And be sure to join us for our next Humanizing Healthcare discussion with Lawrence Hamilton, Executive Vice President of Performance at the Permanente Medical Group, next month in August. It should be a terrific discussion. Thanks very much, everyone, and have a terrific rest of your day.